Welcome to the Desai ENT Clinic. Today we will be discussing the management of allergic disease. Forever, as doctors, we are striving in our quest to do our best. However, we are missing out on a fundamental issue that will help our sinus patients particularly, and that is the correct diagnosis of allergy and its treatment. And in this talk, I would like to clarify some of the myths and the mysteries surrounding it. After all, allergy is defined as a condition of unusual sensitivity to a substance or substances which, in like amounts, do not affect others. All the evidence that we have points towards the inadequacy of allergy diagnosis and therapy in India. Did you know that 70% of sinus sufferers are actually suffering from allergy? Allergies are the leading cause for excessive use of antibiotics, anti-cold medications, steroids, so on and so forth. And the question that occurs is that are we not tired of using antibiotics, inhalers and other medications for ourselves and our children when in fact other options do exist? Did you know that India has the highest incidence of antibiotic resistance in the world? And this is often because of frequent and unnecessary use of antibiotics in cases of allergy of the nose and chest, which we call bronchitis. And the frequent use of antibiotics and steroids can definitely be reduced with correct identification of allergy and its treatment. The idea is the natural improvement of allergen diseases by improving the immunity of the patient. Now, we all know that allergies are the leading cause of lost working days for children as well as adults. And according to the World Health Organization, 30 crore Indians are suffering from allergy. There is certainly a better way to treat allergies than continuously putting a young child, for example, on chronic steroid inhalers. Did you know for a fact that continuous use of inhalers and nasal sprays causes growth retardation in children? Although it is not intuitive, but it's true that although it's topical medication, even topical steroids over a long period of time can cause growth retardation in children. There are articles that have shown this, and although the jury is still out on this, let us focus on treating the cause rather than merely treating the symptoms. So, what is the need of the hour today? The need of the hour today is the correct diagnosis followed by the correct immunotherapy, which is 100% natural and specifically directed to the allergen that is bothering the patient. And this helps us to reduce the use of antibiotics, cold medications, and steroids. So, yesterday, the previous many decades in India, we start off the treatment of allergy with pharmacotherapy in the form of nasal sprays, in the form of antihistaminics, in the form of painkillers, decongestion, so on and so forth. And if that fails, we consider surgery. However, as Benjamin Franklin once said, change is the only constant in life. And one's ability to adapt to those changes will determine your success in life. And we need to change our approach for treating allergy. So for that, I present to you Stalargo, which is a system for allergy testing and immunotherapy, and this system seems to work. So the whole idea of treating allergy is to improve the quality of life of allergy sufferers by reducing their use of antihistaminics, antibiotics, and steroids. So, do we really need allergy testing? When you see that 30 crore Indians have significant allergies, perhaps it's reasonable to figure out what they are allergic to, and we wish to improve the quality of our patients' lives. So, we need allergy testing because with allergy avoidance and immunotherapy, and you improve the quality of your patient's life by reducing the chronic low-grade inflammation to prevent allergic triggers, reduce the chance of acute rhinitis going into chronic sinusitis, improve the post-operative results, reduce the use of antibiotics, antihistaminics and steroids, and also reduce the chances of recurrent viral infections. I will come to that shortly. As you are aware, 70 to 90% of patients with asthma also have rhinitis, and 30 to 40% of rhinitis patients develop asthma. So, in fact, patients with allergic rhinitis were 3 times more likely to subsequently develop asthma. So, if treatment is started early, asthma can definitely be prevented. So, having said this, how is the test done? So, there are multiple tests that are on the market, but skin prick testing is accepted as the gold standard for allergy testing throughout the world. They are more accurate than blood tests in most instances, and multiple peer reviewed journals have revealed that prick tests are the gold standard. Skin testing is very easy. It is simple, accurate, and reliable, and even children above the age of 5 can be tested. And most importantly, tests can be customized for specific allergens. It's a very simple test to perform, takes about 25 to 30 minutes per patient, and it reveals very closely the amount of allergies that the patient is suffering from. Why do we need the testing? So that we can go on to specific immunotherapy. And the aim of specific allergen immunotherapy is to influence the immune system in such a way that it becomes permanently used to the allergen and that symptoms don't occur. Over an extended period of time, patients are regularly given increasing dose of the allergens that cause the symptoms, and once the final target dose is reached, the therapy is continued for up to 3 years in order to allow 70% of the patients to remain symptom-free, often permanently symptom-free, and they need much less allergy medication in times of provocation such as the changing season or viral URTIs. So the way it works is that through regular exposure to the allergen, the body will learn to react less. And today, globally, it is a specific method of choice for treating many allergies, but it requires patience and persistence on the part of the patient. And what happens with specific allergen immunotherapy is that no drugs are present in this immunotherapy. These are purely natural protein extracts of whatever it is that you are allergic to, given to you in gradually increasing concentrations till your body becomes immune to it. And the evidence is absolute that immunotherapy is the only medical intervention that could potentially alter the natural course of allergic disease. And fortunately, when you are using sublingual immunotherapy, no major side effect requiring stoppage of immunotherapy have yet been reported. The USP of the Indian allergy system is that it is India specific and for Indian conditions. So Stalargo is the only system that is not only Indian FDA approved, but also has CE compliance as far as European certification is concerned. Immunotherapy preparation also has to be precisely done, and immunotherapy is currently individualized for each and every patient and prepared with European standard compliance systems. Now, we are the only allergy company which is also compliant with USP Chapter 797. These are the standards which are in use for compounding these allergens. And these are done in a HEPA filtered environment, and each and every clause of USP Chapter 797 is met. So the evidence is very clear. According to the European Academy of Allergy and Clinical Immunology, allergen immunotherapy has a disease modifying effect and not only reduces the symptoms but also helps stop the progress of the disease. It has long-lasting benefits even after stopping of the therapy, and there has been evidence that up to 12 years of efficacy following the stoppage of immunotherapy has been reported. Now, there's always been a question of whether the immunotherapy should be delivered by injection or delivered sublingually. Now, the advocates of injection immunotherapy are of the opinion that it is more effective, but more and more studies have shown that sublingual formulations are as effective as subcutaneous formulations, with one fundamental difference, that is without the risk of anaphylactic shock. The problem with subcutaneous immunotherapy is that the patient has to go multiple times to the allergologist to receive the injections. And ideally, the allergologist has to have resuscitative equipment to make sure that in case the patient suffers from anaphylactic shock, the patient can be revived. So, such when sublingual immunotherapy in form of drops, which is self-administered in the comfort of your own home, is available, why would, and it is known to be equally effective, it does not make sense to take subcutaneous immunotherapy. Again, the ARIA guidelines of 2008 also have said, and these are reiterated in 2019, that sublingual formulations are as effective as subcutaneous formulations. So, according to the World Allergy Organization papers, it will actually, sublingual immunotherapy can cause the symptoms to subside for a long period of time, and it also prevents new sensitizations. That means that immunotherapy effects last for a long time after stopping. Allergen immunotherapy is recommended by the ARIA, which is the gold standard guidelines for allergy treatment, for secondary development of asthma, and it is recommended that slit is safer than subcutaneous, and oral immunotherapy can be used in children and adults with pollen rhinitis. So today in the Western world, immunotherapy using sublingual drops, especially in Europe, is the mainstay of treatment of allergic rhinitis and asthma. And it is time that Indian methods of treatment also adopt to this rather than purely pharmacotherapy reliant management. Having said that about air allergens, we must also discuss food allergies, because no discussion of allergy is complete without the discussion of food allergies. Now, food allergy is an immune response that occurs soon after eating a certain food. It is very common but poorly diagnosed. When these food specific antibodies encounter the food protein and bind to it, they trigger the release of histamine and other molecules that cause allergy symptoms like bloating, nausea, vomiting, diarrhea. You can also get nasal allergic symptoms with food allergy like sneezing and watering. Also, commonly, skin rashes and eczema can also be due to food allergies, and it can even cause lower respiratory symptoms like wheezing and breathlessness. So, there's an entire spectrum of symptoms that are caused by food allergies. But what most people say is that food allergies cannot be treated, but the reality is that food allergies also can be diagnosed and treated. Remembering that you can have itching, sneezing, and other stomach reactions all the way up to anaphylactic shock, it is important that food allergies be tackled. So now, in order to correctly diagnose food allergies, for the first time in India, Avexia introduces molecular level component testing. Extract-based allergy tests have proven useful for the identification of the culprit antigen. However, an additional molecular idea can complement the extract test results to reach the optimal therapeutic decision. What does this mean? It often means that many hyperallergenic patients have multiple positive allergies. Now, if 20 or 30 different foods are really showing up as allergic on skin prick testing, obviously it is not logical that a patient can avoid so many foods. So, it goes to show that the patient is having the suffering of hypersensitive reaction rather than true food allergy. So how do you differentiate between true food allergy and just a hypersensitivity to that particular food? So true food allergies can be determined by component testing of the major allergen components of that food. For example, peanut storage proteins such as ARA H1, 2, 3, or 6 can cause allergic symptoms up to anaphylactic shock. In contrast, ARA H8, which is a PR10 protein, does not cause any harm, but even if you are allergic to ARA H8, the skin test will be positive, and therefore you will be confused. You will ask the patient to avoid peanut when in reality he is merely sensitive, not allergic. Now, again, a common allergen, that is milk. It consists of lactalbumin, lactoglobulin, and casein. Anaphylaxis is generally due to casein allergy, while allergy to either lactalbumin or lactoglobulin will cause the skin prick test to be positive, but not allergenic. So, molecular component testing is very important.
Allergic reactions to pollen, animal dander, or various foods affect the lives of millions of people around the globe. The causes of those allergies often remain undetected. This can lead to a severely impaired quality of life. With the identification of allergens at the molecular level, individual solutions can be offered to patients. Traditional IgE tests are not able to resolve sensitization patterns at the molecular level. The solution is a new test that can simultaneously determine the IgE profile to a plethora of allergen sources and molecular allergens, as well as total IgE. Macroarray DX's Allergy Explorer allows the simultaneous determination of sensitization against a multitude of different allergen sources and molecular allergens. With the help of nanotechnology, every allergen source and molecular allergen can be optimized for production. High quality for every test feature can be ensured. A small volume of serum or plasma is sufficient to detect your patient's sensitization pattern. Cross-reactivities often make a clear-cut interpretation of test results difficult. With the help of molecular allergens, the true sensitizers can be identified easily. To allow for a maximum of flexibility for the physician, the allergen panel can be adapted to the patient's needs. Multiplex on demand. Dietary recommendations can therefore be based on a systematic approach to avoid unnecessary or even dangerous restrictions. Allergen sources which are perceived as eliciting symptoms can be reintroduced into daily life. Allergy Explorer. Reliable, affordable.
And most importantly, for the Indian conditions, it's very much affordable as compared to a similar panel created by Immunocap or some such thing. Now, another important point is that true allergy can be differentiated from multiple sensitization using molecular allergy.
IgE antibodies
IgE antibodies against cross-reactive carbohydrate determinants
can lead to many
CCDs
positive results
can lead to many
in
positive
extract-based
results
tests
in
and some
extract-based
molecular
tests
allergens.
and some molecular allergens.
CCDs are predominantly found on
CCDs are
allergens
predominantly
in
found on
Hymenoptera
allergens,
venoms
in
and allergens
Hymenoptera
of plant
venoms
origin.
and allergens of plant
To
origin.
address this issue,
To address this
macroarray
issue,
diagnostics
macroarray
provides a CCD
diagnostics
inhibitor
provides a
with every
CCD
allergy
inhibitor
explorer
with
test
every
kit.
allergy explorer
Before
test
the
kit.
allergy explorer is
Before
performed,
the allergy
the
explorer is
inhibitor will block
performed, the inhibitor will
CCD-specific
block
antibodies,
CCD-specific
and only the
antibodies,
protein-specific
and only the
IgEs that
protein-specific
remain in the patient's
IgEs that
serum
remain
will
in
be
the patient's
detected.
serum will
This
be
results in the
detected.
measurement
This
of only
results
the
in the measurement
allergen-specific
of only the
antibodies, which will
allergen-specific
facilitate
antibodies,
the
which will
interpretation of your
facilitate the
patient's test
interpretation of your
results.
patient's test results.
Allergy Explorer.
Allergy
Flexible,
Explorer.
reliable,
Flexible,
affordable.
reliable, affordable.
So, of course, the gold standard for the treatment of food allergies is avoidance. However, we can also use sublingual immunotherapy and oral immunotherapy. And both have shown excellent responses for peanut, milk, rice, wheat, egg, except for the fact that persistent consumption is required to maintain the effect. Immunotherapy can desensitize patients to a variety of specific food allergens and shows really great promise. And immunotherapy in the form of oral immunotherapy can actually allow a patient who is suffering from even anaphylaxis to start consuming normal day-to-day foods without any allergic response. However, awareness of allergy treatment is very low. As per an ISMAR study done in 2013, which addressed the unmet needs in allergic rhinitis, only 20% of ENT specialists are using immunotherapy. However, 80% of those 20% have found it to be clinically significant. That means that immunotherapy itself works. It's just that the doctors are not as aware of it and not using it as often as they should in order to benefit the patients. So what are the benefits of immunotherapy? Up to 74% of patients required less than 3 periodic topical and systemic steroid courses per year over a 3-year period. So may we recommend allergy testing and immunotherapy? Because the advantages with allergy testing and immunotherapy, as we improve the quality of the patient's lives, improves the endoscopic surgery outcomes, improves the patient satisfactions, as I mentioned before, reduces the use of antibiotics, antihistaminics, and steroids. And so, Stellar Go is a product that gives you end-to-end solutions for allergy and effective oral immunotherapy. For further information, you can visit allergyworld.in or evexialifesciences.com. Thank you for your patient listening, and wish you all the very best for an allergy-free world.